Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're glad you joined us. We're very glad you joined us. Before we begin, I'd like to thank our sponsors, Altman Health Systems, Studio Arts and Glass, and Genier Appraisals and Liquidations. Today, Brad and I are broadcasting from our administrative offices, and our very special guest is Roger Marzano, Vice President of Clinical Services at Yanke Bionics and licensed and certified prosthetic.
Prosthetist, orthotist, and pedorthist.
Or Pedorthist. Okay. Good morning, Roger, and welcome.
Good morning, folks.
Welcome to the show.
Thank you very much.
Okay.
All right. At Yanke Bionics, their philosophy is that life should be lived to its fullest extent. It's about spirit, a winning life, and accepting no limitations. Their mission is to help patients attain their personal goal, whether prosthetic or orthotic devices are needed. Yanke Bionics can create a customized bionic device that enables patients to enjoy their favorite activities, whether it's walking, running, dancing, playing golf, climbing mountains, or even if a patient has lost a limb. This morning, we're going to talk about Roger and the services offered at Yanke Bionics and how they can help you achieve your personal goals. We'd like to remind our listener that our program is also available on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe to our program.
Okay.
Thank you.
Roger, welcome to the show again. Please introduce yourself to our listeners and tell your listeners a little bit about yourself, your background and training, and the work you do at Yanke Bionics.
Well, I was very blessed early on that my senior year of high school in Akron, I got to be I was awarded the outstanding senior draftsman. I was interested in being a draftsman or an architect. And unfortunately, my father liked Northfield Racetrack better than my college education fund. So I was early on told that I was going to have to find a way to go to college. It was because I was going to pay for it. So my senior drafting teacher was also the OWE teacher and said, "Hey, Roger, I got an opportunity for a part-time job to work for a brace company in Akron, filling casts and doing labor after work. Would you be interested?" I said, "I sure am." So he actually picked me up, took me to the interview in February of 1979 and told Mark Yanke, the owner of the company, said, "If you hire this guy, you won't be disappointed." So I started that February. When I graduated that year, started going to the University of Akron at night that fall. And it took me 8 years to get my degree that way for an undergraduate degree because I paid for a course and went as I went. Fortunately, the owner then saw in me the opportunity and actually paid for me to go to Northwestern Medical School in Chicago for the field of orthotics and prosthetics and paid my wages while I was gone. And just opened up a whole door to me. And here I am 43 years later, a certified licensed orthotist and prosthetist and pedorthist, which means I do orthopedic braces, orthotics, artificial limbs, prosthetics, and pedorthics, which is very unique because that's specializing just in foot and ankle pathologies only. And 30 some years ago, we opened an office in Crystal Clinic in Akron area, and I got tied up with an orthopedic surgeon who was a foot and ankle specialist and basically turned me into that guy that could fix all these difficult things. So because of that, I developed a foot and ankle relationship with the medical community. And here we are 43 years later. I'm doing orthotics and prosthetics in the Canton community. We've been in Canton. The owner was from Canton, and we've been in Canton for a very long time. And I was blessed. We actually had an office on Clarendon and Tusk in an old 3-story house there. And I used to walk over to Cap's restaurant and get pies for lunch every day, right by Altman Hospital, because we could smell those pies baking all morning long. So we had to go get a piece of cherry pie. And then I got Hagee nuts and I got all the good stuff that's around us. So
how many diets were you on?
Oh, I've been up and down so many stinking times because Joe Yanke, the founder of the company, was a very large man and loved his pie. So I was blessed to get a lunch out of him every day, and that family just treated me right. So I'm very blessed. Today, it's very difficult. You have to be a biomedical engineer to get into orthotics and prosthetics, and I started from the ground up and was able to build a career around this. And that's why we're here on West Tusk. And I love the Canton community. It's been exciting as can be to watch Canton grow and see the medical community grow.
Very interesting. So I know you are located right down the street on West Tusk. Tell us about the scope of services offered from that location.
Stark County, actually, our Canton office is one of our flagship offices because it's one of our second largest locations. We do all our manufacturing at Akron at a 17,000 square foot manufacturing facility there that houses our CAD systems and our 3D printers. And we can provide full scope of services in Canton, and that means from the microprocessor controlled knees and prosthetics that we do to scanning an infant's head to make a custom molding helmet for positional plagiocephaly, if you want to say that 10 times fast. But our scope, plus we provide all the inpatient services as well as outpatient services in nursing facilities in our counties that we care for. So we go to Altman Hospital, we're in Mercy Medical Center, we're in all the associated Orville, Altman, Orville. I mean, basically everywhere there's a hospital, we provide that 24-hour a day, 7-day a week care. So it's difficult to maintain that level of care. No one wants to have to go down to Altman to fit a cervical device at 10 o'clock at night. But if the patient needs discharged and that's what needs done, then that's what we have to do. And unfortunately, medicine has grown so much in Stark County with the acquisition and the Cleveland Clinic coming to Mercy and Altman growing with leaps and bounds and the medical community improving. Our Canton office had to be a facility with a full service scope. So we have a van parked behind our building that a young lady runs at all the nursing facilities and takes care of those orthotic and prosthetic needs in those areas and services. We if necessary, we can go to a patient's home to care for them, but it's a little bit difficult to do some of these services that we provide in a patient's home. And obviously it's very difficult from a liability standpoint. And that has changed a lot too, as time has went on with HIPAA laws and all the other things that we go through. The legislative and that end has overcome the true reason that we're in business is to, provide orthotic and prosthetic devices for those that need it. So it's been good, but I got to tell you, Canton is a knockout community and a knockout office. We have several practitioners here, actually 4 of the practitioners that see patients here. So it's very busy. We're here in Canton 8 to 5, Monday through Friday, closed 12 to 1 for lunch. Again, on-call services come out of here. And we are summoned all over the place to do that. So we are blessed to have a great relationship with the medical community in Canton.
Very interesting. So Roger, in order for our listeners to understand how the importance and scope of what you do, share 1 or 2 of your favorite success stories and how Yanke Bionics improved a life or lives.
It's amazing. And that's what's so neat about what I do is it's not like doing surgery where you may not have the most favorable outcome or you could have a secondary complication. Usually every single person we touch leaves us in better shape than when they came in, whether it's physical, emotional, or psychological. They're leaving here with some semblance of hope. But well, I guess the 2 most recent ones that really got me was I came into an office in Parma that I work at 1 day a week, and I had a note card, and the note card was from 2 women that have lived together for 40 years. They are the sweetest couple I've ever seen in my life, and I've just made her custom-made shoes for the last 28 years I've cared for her. And so consequently, I've grown old with them and they've grown old with me, and I know about all where they go for Florida. So I made her a pair of shoes this year. They were talking because they didn't make it to Florida because the hurricane wiped out their condo in Fort Myers. And the one wanted to go down real bad and the other one was really content with staying at their home. And I was talking to him about, life is nothing more than concessions. We all make concessions, and we make the best with what we're given and what we do. And I was just illuminating to the two women, that it's not about where you are, it's about that you're together and finishing your lives together like this, whether you're in Cleveland, Akron, Canton, or Florida. So I get this card and I open it up, and she says, Roger, we just wanted to share with you. Yes, I have a great pair of custom made shoes, but you're not just the healer of soles of the feet. You're a healer of our souls as well, because your wisdom that you shared with us about our tough decision about going to Florida rings true. And you really made us realize that we can be happy no matter where we live. So, here's a patient that I'm thinking all I'm doing is custom made shoes for. And she takes the time to mail that card to let me know that the emotional connection that we made was even better than the physical connection that we made. And that just blows my mind that anyone would even take the time to do that. So that's a neat story. And then down here in Canton, I had a guy that I had terrible diabetes, 30-year history of diabetes, unfortunately, which is what we see a lot of. And he actually had had to wear a brace, and it was very difficult. He did heating and cooling work. And he is a very large man, but very active and the sweetest soul you ever wanted to meet. I wish he was my brother. And he unfortunately succumbed to a below knee amputation, but I cared for him with his brace for probably 15 years. So I knew his family, his mother, everything that he did, and his hobbies. But what was interesting, because we have different people here that have different skill sets, because I do mostly orthotics and difficult lower extremity work, we have a prosthetist here by the name of Renee, who I was able to, after my patient sustained the amputation, I was able to introduce him to, and actually have him meet with Renee and develop a relationship with her. And that relationship has just blossomed the same way it has with me. And Clinton came in and said, I feel like I got a brother and sister in your company. You two have just wrapped your arms around me and took me through the most difficult time of my life. And I think that's the biggest two success stories I can share with you that really ring true. To me, I'm almost serving God and medicine, and to have this opportunity to make these people whole again, nothing better than that.
Okay, Roger, our first break is here. You are listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Friends, just a reminder to stop by the pharmacy and talk to our pharmacist about our new Health Matters prescription drug savings program. We want to help you stay well and save money. So, Roger, how has technology changed in the field in the 40 years you've been doing this?
Oh my, I feel like a dinosaur anymore, because I remember going to Children's Hospital in Akron with a pediatric orthopedic surgeon and taking a tracing with a pencil and a piece of paper of an infant's foot and ankle, and taking measurements. And I had to construct these little metal braces that were attached to the shoe like Forrest Gump braces, called Phelps braces. And I rode around in the back seat of this orthopedic surgeon's Mercedes-Benz for 5 years, doing clinics in Martins Ferry, West Virginia, Salem, Ohio, Youngstown, because there no such thing as a pediatric orthopedic surgeon. That was like almost unheard of. He was God. And he just unfortunately just passed away a few years ago and practiced here in Canton for many a year. But it was so, I went from taking a tracing of a leg to now I can walk in with my iPhone and literally open an app on my iPhone, and I'm going to scan your limb with my iPhone. I can send a digital file to my manufacturing facility in Akron, and we have a CNC carver that has a multi-axial arm that can carve whatever shape, whatever image that I make with my phone, and it carves that model. And the model can be changed, rectified, made larger, smaller. It's so precious when we're making body jackets, TLSOs for people's spines. In the old days, I used to have to go in the room. I'd literally wrap you in a plaster of Paris mold. Have to take a plaster of Paris model of your spine and body to make a post-operative back device. And I did that for plenty of years in Altman Hospital and Mercy. Wasn't a big fan by the nurses. Today, I can go in the room, scan you with my iPhone. The next day, I will have your brace ready for you in the hospital so that you can leave after a massive spinal fusion and never have done anything other than take a few minutes in the scan. So the technology is outpacing, unfortunately, the insurance company's ideas to pay for it. So, you know, these technologies, unfortunately, come with a great cost when they're in their infancy. We have casting method that we can put your below knee limb into a vat of water, for lack of a better term, and we can create uniform compression by hydrostatically increasing the water pressure on whatever the limb is inside this container. What that gives us is simulated loading of your limb inside your socket. So we're making prosthetic sockets because of that modeling technique that simulates weight bearing. And we've never been able to do that before because it was always a non-weight bearing impression technique. So we're getting better fitting prosthetic sockets. Those devices for each one of our offices almost are $80,000 to have one of these casting devices in here. You know how many legs we have to make to recoup the expense of that? But unfortunately, if we're not out there doing this, then we have to lead by example. And that's why our business have been so successful, is because you're not going to go to Minnesota, Chicago, New York City, or Miami and get any technology any different than you can in Canton, Ohio with us. And Mark Yanke, the owner of the company, made sure that we were going to have the technology to carry us into the next millennium. And the man's amazing. I got to tell you, he probably won't want me to tell you that he's over 70 years old, but he comes to work every day with a fire in his belly. We just bought this massive CNC carver that's in our Exchange Street office that had to be bolted to the floor, and it came out of the automotive industry. And this thing can take a drill bit and mow a piece of foam, a block of foam. And this arm can go around this foam in 3 minutes and make whatever we put into the computer for it to make. It can trim plastic. It's just, the technology is unbelievable. And I'm just blessed to be hanging on compared to where it used to be. So I'm glad that I can use an iPad now to scan a limb. I scan feet for diabetic shoes and inserts with a.
You should be you should be a commercial for iPhone, iPad.
No kidding. I know. Well, you know what's amazing is they end up making these platforms available to us. So I have probably 9 different manufacturers' platforms on my phone that I can open up, look at a component, and I got to tell you, that's what was going to lead me to the next topic, quite honestly, is how has the reimbursement changed for these services, and how are we getting paid for this high technology? And to answer your question is, we're not. Because as the services have increased, so I'll give you an example. There are now very lightweight carbon fiber ankle braces that you can wear if you have drop foot or if you have sustained a partial foot amputation. You can have these nice lightweight carbon fiber AFOs. The problem is many of the insurance contracts that Yanke Bionics has with an insurer is a discounted rate off the Medicare allowable. Well, just because I buy an ankle brace from XYZ company that has the market of carbon fiber AFOs, well, guess what? I'm being reimbursed $15 over the cost of that AFO. So the manufacturer made the majority of the benefits. And
sounds like the prescription drug business.
No, it is. It's exactly. And that's why I'm saying this to you, because you two can truly appreciate what I'm saying, is that the margins are less. So that's one of the reasons why Yanke Bionics had to reach out and have 11 locations. It's the same reason you guys have multiple, pharmacists and locations as well. You just have to be, we have to do more and make less money. And it's difficult. We are constantly, our professional association is constantly lobbying CMS and Medicare to make them recognize that their payment system is antiquated for the orthotics and prosthetics. And many of the patients come in here, they see online this guy that got his below knee prosthesis, and he's running with a carbon fiber foot and this special method of holding it onto your limb. And so the guy comes in with his insurance company and with his insurance card says, hey, I'd like to get that prosthesis there to make me run as well. And they don't realize that that's the Mercedes-Benz coverage level of care, and their insurer is the Chevrolet of coverages, and even less, unfortunately. So you guys know what we try to do is provide the best, most advanced device that we can, given the limitations of the patient's insurance company. And just
Okay,
like in
Roger,
your world.
I got to cut you off here.
Okay.
It is the bottom of the hour and time for the news. We have to listen to the news. Okay.
Hey, I'm happy to hear it.
Okay. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. We are back and you're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning, we're talking with Roger Marzano with Yanke Bionics. Did I pronounce your last name correctly?
You sure did.
Doggone, that's really good. That's part of it.
You're dead on. I'm not going to ask you to say prosthetist, though.
Prosthetists? I got
Yeah,
pretty
you
close.
did it. Oh, man,
Aren't
look at you. You just
All
did it. You got it down now.
Yeah, I'm pretty close. You know.
Heck
whatever.
yeah.
Okay. Oh gosh.
All right. Well, we've been waxing poetic about all the advancements in your industry, and I guess I wonder, what do you think is next? I mean, what are you excited about coming down the pipe?
Well, I got to tell you two things that's really wild. One, would involve us more than the other, but we are actually fitting a patient with its first osseous integration prosthesis. So what that basically is the same way that they do dental implants, where they put a little post into your bone of your jaw, and then they attach a tooth to it. There's a physician in West Virginia that is trained where they actually put a titanium stem through the bottom of the bone of the level of amputation that the patient sustained. Then out comes a pin that we will then attach a prosthesis to. And the prosthesis will be attached to the pin. One of the greatest challenges is harnessing a patient's skin inside of the prosthetic socket, because you have a lot of friction and shear and pressure related issues and volume changes in the limb that necessitate constant changes to the prosthesis. The osseous integration eliminates. It's a positive fixation right to the bone of your leg. So there's no socket, there's no uncomfortable thing. All the patient does is plug their prosthesis on the end of their limb like they do their dental implant and walk out the door. So that's on the horizons, and it's kind of exciting. It won't be for every amputee, but traumatic amputees that sustain an amputation that's young and in an automobile accident, or upper extremity patients, it's really amazing. And then the second thing that's on the horizon that is just, it's hard to even fathom, is limb transplant surgery. So we are involved in making a harness for a patient that had an arm transplant. Wow. He was an amputee that lost his arm. And when you lose a dominant arm, you lose tremendous function of your upper extremities. You do everything one-handed. So instead of getting a prosthesis, he got a transplant, an arm transplant from a donor. Wow. So I've seen face transplants, I've seen uterus transplants, but I've never seen extremity transplants before, which is absolutely amazing, because you have to hook up nerves, blood vessels, bones, have compatibility. So, is that going to eliminate the need of prosthetics in the future? Probably not. But it's certainly something that I never thought that would happen 10 years ago, and it's happening today. So this field is advancing, at warp speed, as is medicine. I mean, every 6 months, there's something that's obsolete already. And the next new surgery is out there and ready to go. I've watched it in orthopedic surgery, the internal fixation that they use in spines and fixing fractures. Before, I used to have to do bracing around these legs if you broke your thigh bone because you fell in your kitchen. Today, you go in the hospital, they pop a screw in you, you're discharged the next day and out walking. My wife had her hip replaced and went home the same day and back to work in 3 weeks. So, that's happening in the field of orthotics and prosthetics as well. Interestingly enough, I'll tell you, we were on the Extreme Home Makeover show. If you guys remember that, I dated myself.
Oh, yeah.
We actually highlighted an amputee from Kentucky that came to us, and we made a prosthesis while he waited. We made an above knee prosthesis while they were building his home down in Kentucky. So it's interesting. There was never a way that we could build a prosthesis while you wait. But today, if you go to our Exchange Street location where we're manufacturing these things, we've literally had to do that in certain situations.
Incredible.
Amazing.
So this arm replacement thing, is that from a cadaver, or is that manufactured product?
No, it was a patient that passed away and had donated his body to, so it's a live donor. It's someone that expired, just like they would with a heart transplant or a kidney transplant. So they find a compatible person tissue wise who they know who is going to unfortunately expire from one process or another. And that's how they match up. Same way, my friend just got a Vietnam veteran, just got a stem cell transplant at the Cleveland Clinic, and they matched a donor to him. A person they didn't know donated his stem cells. Can you imagine going into a hospital and say, hey, I'm going to give my stem cells to someone that needs them? So it's amazing the things that are happening today, and it's happening at warp speed in orthotics and prosthetics, which is refreshing. I got to tell you, I'm glad to see that I'm not making Forrest Gump devices anymore.
Yeah. Well, the leg thing, okay?
Yes.
Can you do it above the knee also?
Yep. Yeah, actually, that's one of the most favorable levels, because that's the higher you go, the more limb you lose, the more tissue we have to contain inside of a socket. So if you lose your leg just at the knee level, imagine all that thigh tissue that has to fit inside of a prosthetic socket that causes chafing and irritation at some instances, and volume changes as your limb changes. Your thigh gets bigger, your thigh gets smaller. With the osseous integration, you have no socket. You're not sitting on anything. You're literally plugged into your bone. So it's a very positive level of, and it's 1-to-1, meaning when you bend your thigh, that leg goes right with you. So is that, how far away from that? It's happening across the country more and more. And we never thought we'd see one here in Ohio. The VA is doing it on some veterans in trials. Oh, wow. And so that's what's amazing is that they're able to do that. And it's so exciting to be part of this, because I've been with the field for so long. It's so exciting to see the changes. Like you guys as pharmacists, you see changes in medication that's more effective. Every year you get a more effective medication that targets the problem of the patient. But what happens with that medication is 4 times as costly to the patient. And most people don't have that pocketbook to get it. So consequently, that's the way orthotics and prosthetics is. It's very much like your pharmacy business in that there's options out there, but we got to wait 5 years for the insurance industry to recognize it and to say, hey, this is a good option. And we can save money by fitting a patient with a higher end prosthesis so that they can be more active and then not have cardiac problems later on in their life because they're sitting in a wheelchair because they got a crappy prosthesis. Wow. So it's a vicious circle in our industry, just like it is in yours. I mean, you see patients that go without their medication because they can't afford it.
Yeah.
And
Very
we see
interesting.
patients, it's so sad, but we see the same patients that go without their prosthesis or go without their diabetic shoes and inserts because they can't afford their copay. It's so
Man.
sad.
So, Roger, what do you see as the next big health crisis coming our way in years to come?
Probably same thing that you guys may be seeing is diabetes. I think diabetes and obesity is creating so many health problems today. We, never in a million years did I know that I would have to have a prosthetic component that could sustain 450 pounds. The manufacturers haven't made those type of components available to us for those patient sizes. So as patient population gets larger, so does the component needs, so does the unfortunate healthcare problems that come along with us. And I think diabetes is exploding, and diabetes comes with a great amount of health complications, both neurologically as well as physiologically. Not to mention, that over 60% of the amputations performed in the United States are performed on a diabetic patient that had a foot ulcer. That's a huge number. And so, that has to change somehow, some way. And unfortunately, the world is mega size. Everywhere you go is super size. I remember when I was little, the small pop, you could take 3 sips and it was done. Today, a small pop is the size of a extra large at going through the drive-through locally.
Half a gallon.
Yeah, and the patients are coming in. I have my patients coming in carrying a half a gallon super big gulp of Pepsi at the same time as I'm trying to help and counsel them with their problems. So you guys know you're seeing the same people I'm seeing, and that crisis of diabetes, I think, is it's going to be a very costly disease process to care for.
Okay. Our final breaks here, Roger. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Man, we are talking to this genius today, this Roger guy. He really knows some stuff. Okay, and it's very interesting what he's telling us. I had no idea some of the things that we've advanced this far. Replacement of your arm, my gosh. So Roger, Brad, you're up.
Well, Roger, we talked a bunch about your technology you have available and tools, and we've even lamented about how, there's a lot available, but sometimes insurance companies don't necessarily want to cover what the maybe the most efficient option might be, or the best option for a patient. What other comments do you want to talk about with relation to common services that maybe listeners don't exactly know? And we've talked amputations and things, but what other things can you do for patients that maybe the general population could benefit from if they knew the services you offered were readily available in their minds?
Good question, Brad. Thank you. But a few things. Number one, I want to clarify that in order to be seen at Yanke Bionics, you have to have a prescription. We can't do anything without a prescription from a physician. But many of those prescriptions are actually driven by the patient going in and asking their primary care doctor, saying, hey, Dr. So-and-so, I've had plantar fasciitis now for a year. I've tried the over-the-counter insoles and stuff, and, I just can't seem to get it better. Could I go to Yanke Bionics and get custom orthotics for this? Or, what other options do I have? Unfortunately, today, people have to drive their own healthcare bus. If you don't ask, you don't get. So consequently, I tell patients all the time that they need to be inquisitive with their physicians and say, hey, I've been wearing this back brace for my arthritis of my spine in the last 4 years. Is there any other options that I have available to me that I could go look at? Could you give me a prescription to go to Yanke Bionics and see if there's a better spinal brace that could help me with this pain? From, just the increase in osteoarthritic changes, we're living longer, we're more active, there's more osteoarthritic changes in our body. So, if you're seeing a rheumatologist or your primary care doctor, you can ask them, hey, I'm starting to get some early arthritis in my knee. Is there anything that I can do proactively to slow that down? So, and if you've not had any exposure to orthotics and prosthetics and don't even know that it's available out there, but have suffering from some physical disorder of some sort, whether it's chronic pain, whether it's a deformity of your lower extremity or your hand, you know, unfortunately, the only way you're going to get it looked at is to ask your physician to look at it. We need to make the physicians aware of this problem, and so that, you know, you can investigate on your own. It's amazing. We're seeing traveling physicians. We're seeing physicians that go to patients' homes now, and we're getting prescription faxed for a patient that is housebound, that is tripping and falling in their home because they have MS and their foot's not working any longer, but they can't get out of the house. So, you know, medical care is mobile care now. There is, you know, physicians that go to homes. We don't always travel to homes. We can't do diabetic shoes and inserts in a patient's home just because you have to size shoes, and it's difficult to bring 38 pairs of shoes to do that. But we can see.
Oh, why is that?
Yeah, I can't bring a van full of shoes like they do at Goodyear when they want to fit you with your shoes. But the key is that we can. I mean, you have a prosthesis and you're housebound, and your prosthesis, you know, has to have repairs done to it. You know, we do have mobile clinicians. Renee here in Canton is all over the place. Half of her day is spent in a van seeing patients out of the office, both at extended care facilities as well as in, unfortunately, in patients' homes. But it's not the most optimum environment because some of the work we do is kind of messy, and we may have to go back and forth several times. But you know, the nice thing is I always encourage patients to look online at devices. If you have an ankle brace, take a look online. Sometimes the internet's a good thing. And as you guys know, in medicine, sometimes it's a bad thing because the patient will come in and say, why can't I have this medication because it doesn't give me this side effect? Well, they ask me, why can't I have this fancy carbon fiber Mercedes-Benz AFO when I take 6 steps a day? Medicare isn't going to pay for that fancy carbon fiber AFO for a patient that is non-ambulatory. So sometimes they see something on the internet that may or may not be applicable to their particular problem, and they're disappointed to find out that that may not work for them. But again, you know, I tell patients every day, you have to be an advocate in your healthcare. You have to advocate for yourself. You have to go into your physician and say, please, Dr. So-and-so, please look at this situation I have and help me, you know, find a way through this. Because unfortunately, patients go and talk to a physician or a professional about a problem, don't necessarily get the answer they want to hear, and then they give up. And that giving up means that they're suffering in pain or tolerating a poorly fit prosthesis just because they don't know that they can go somewhere else and get it looked at. So, you know, we just want to be the sounding board for the Canton community and for those that are physically challenged. I mean, we have offices we're up and down 77. We're in Cambridge, we're in New Philadelphia, we're in Canton, we're in Akron, we're in Lyndhurst, we're in Lorain, we're in Mansfield, we're in Worcester. We literally circle the Stark County community. So we are accessible. Our facilities are all handicapped accessible with power doors on the front. So we know the population that we service. And I can confidently say to anybody that has physical challenges in the Stark County community or anywhere Yanke Bionics is, that they're going to get the same quality of service that you could get in the largest metropolitan, biggest healthcare centers in the world. And there we are providing the quality of orthotic and prosthetic services in Canton, Ohio, that you could get anywhere. So I'm proud to say that in the Canton community. And that's why I've worked at Yanke Bionics for 43 years. I know we are leading the pack when it comes to this. And that's why we are surviving in a very challenging times. Our field is, I got to believe, is as competitive as your pharmaceutical field is. they can, there's a pharmacy on every corner, and there's a lot of orthotic and prosthetic facilities out there, but we want to be the one that is going to get you back on your feet and hopefully, improve whatever situation you have.
Very good. Wow.
Roger, a lot of the themes that you do share echo in the pharmacy world. I mean, we are actively educating our patients to expect more from not only their pharmacy, but their providers, their physicians, their nurse practitioners. I mean, unfortunately, we're in an environment where you need to ask questions. And, the common thing lately in the pharmacy is how can I save money on my prescriptions? Because you're right, there's these big, shiny, new fancy drugs that cost $5,000, $6,000, $7,000, $8,000, $9,000 a month. But you know what? There might be something for $15 that can do just as well, and it doesn't break the bank, and they can go to the grocery and eat. So I think the theme for all of us is, for patients and caregivers and everyone, don't be afraid to ask questions. There's no stupid questions. I mean, there's got to be a way for you to find a path, and there's help out there. Unfortunately, you've got to do some work though to find it sometimes.
Yeah, I agree with you 100%. And misery loves company, Brad. So we're in the same boat together, but you guys look at it the same way as we do. You develop relationships with your clients, your patients, and you hope that those relationships are going to make them come back to your company because you did a better job at helping them advocate for their care, just like we are with our patients. So it's nice to be partnered with you guys and have you right down the road from us to be able to refer patients to when they need the pharmaceutical care.
Likewise.
Guess
All
what?
right, we're out of time.
Yeah, guess what, Roger? We need another couple hours here.
Yeah.
But they won't give it to us. Okay.
No, but I'm so happy. I thank you guys for the opportunity to share a little bit of what I do here, a little bit of the magic in Canton. And it's been great serving the Canton and Stark County community down here.
Right.
We're going to be around for a long time.
Okay. Well, I thank you very much, Roger. Roger Marzano, Vice President of Clinical Services at Yanke Bionics, and a licensed and certified prosthetists or
orthotist, and pedorthist.
Okay. All right. Sorry, I just couldn't knock that one out. Okay.
Thank you, man.
We would like to remind your listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Altman Health Systems, Studio Arts and Glass, January Appraisals and Liquidations. As always, we thank our sponsors and listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week. We'll see you right here again next week on News Talk 1480 WHBC. Thank you, Roger, very much. Okay.
Thank you, man. Have a great weekend.
Yes, sir. You too.
Thank
Very
you.
good.
You too.
Very
Bye-bye.
interesting. Bye.
Thanks.